Ayanda, perhaps just to get into it, a couple of years ago the NHI seemed an impossible dream, a massive scheme that could we pay for it, could we have the capacity to do it? It seemed like it might not get off the ground, a good theory, but actually it is getting off the ground. Perhaps just bring us up to speed with where it is now.
Well, first of all, I think after the policy decision, a task team was put, which was a ministerial advisory team. They've come out with broad outlines in the green paper of what the policy would look like. And indeed, as you were saying, I think the positive thing about that, many people would say the green paper gave a fairly pragmatic way of addressing this. We've now moved on to the next stage where the minister just about a week ago announced the different pilot districts where piloting work will be carried through so that we can learn from that. And the whole basis of this is that let's pilot, let's learn, and on the basis of those learnings, let's then get into a bit more detail on how the outline of the NHI will look.
So it sounds like you think it's practical. What you can tell of the pilot schemes, are there issues yet about them, about resources?
Well, I think it's a bit early now, but I think the approach that has been taken by government, as I said, is a very pragmatic one. I think there have been an attempt to put the necessary teams in place. I think it's going to be a big challenge. I think one of the big things that government is conscious of that will have to be monitored very carefully is to make sure that as we run the pilots, we don't actually paralyze the periphery around the pilots. And secondly, I think the big challenge is going to be for government to provide very clear leadership so that South Africans can be mobilized to make sure that this pilot become a success.
You talk about leadership. I suppose leadership is one thing, management on a detailed, on-the-ground basis is another. What's your sense of the capacity of government to do this? I mean, certainly the minister has been very impressive in the way he's driven this. He's quite an activist minister. Certainly, you'd probably say he's one of the 2 or 3 most effective ministers. You might disagree with some of what he's doing, but certainly he's getting it done, or getting it started done.
Absolutely. I think one of the greatest advantages that South Africa has at the moment is really the energy and the vision that the minister has brought into this. And I think it has got a mobilizing effect. Quite clearly, there are many, many challenges. Minister has acknowledged some of them. I think we're dealing with a very complex burden of disease. We're at probably one of the most difficult points in terms of managerial capacity in our institutions, and also we've got significant shortages in human resources, and these are not small challenges.
Now you mentioned the pilot schemes. Now what you don't want is to make the pilot schemes work by cannibalizing others, saying, we haven't got enough doctors here, so let's get them from somewhere else.
Absolutely. I think that's something that we'll have to watch carefully. I don't think it's an argument for not doing something. It's just a question of saying, let's be conscious of what we're doing so that we don't create too much artificiality around that. In fact, we then generalize out of a specific that actually is not sustainable. Nevertheless, I think government is fully aware.
What about companies like yourself? You're the big player in the medical aid arena, Discovery Health, and you're a big company. You've clearly taken a decision to engage with government, and I think there's certain private sector players who, even if they're in favour of this, there's uncertainty. You know, how are we going to fit into this? If there are partnerships, how are they going to work? And ultimately, how are we still going to make money? So what have you learnt from this engagement?
I mean, I think, first of all, the overarching vision that's driving this is something that all South Africans should embrace. I think the notion and the vision and the ideal of universal access for South Africans, I think is a good thing. Discovery has taken a view, and we've put a detailed submission where we've indicated our readiness to be a partner to government. There are certain things that are not clear that we say will be clarified and would like to continue engaging as things become clearer. To
the point where perhaps you can help write the policy or change it as you go along because you have expertise?
I think what all of us would wish for as an ideal situation is that in the process of this engagement we build trust. On the basis of that all of us as South Africans see this and embrace this as our common agenda, and therefore engage and put suggestions on the table. It
sounds like, from what you imply, is that there isn't quite the trust that there should be yet. But skills, whatever way you look at it, the medical schools aren't going to suddenly start churning out 3 times the number of doctors as the budget asks them to. It's not going to happen. Where are the skills going to come from? And more importantly, it's not just the medical skills, it's the management of things like medicines, queues, buildings, linen, food.
I mean, I think you are correct in that there are two lines of intervention which I think are very critical. First of all, South Africa is beginning to really explore the issue of other categories of health workers, the so-called mid-level workers, and I think that's an appropriate intervention. The second part is that even with the human resources that we have, with good management oversight, far much more can be done, and I think it's correct for the minister and the department, and I hope that the private sector, Discover has declared that it's ready to do so, to partner with government to assist in the strengthening of that managerial capacity.
It strikes one that half the problems, or more than half the problems, are to do with management rather than health-specific medical or health issues. What about Africa? We're going to be talking about Kenya, and are there lessons here for the rest of Africa, or things that we can learn from the rest of Africa in terms of public-private and a big scheme like national health insurance?
Well, I mean, I think, first of all, one of the areas that we can learn from in the rest of the continent is this area of mid-level workers, because many countries, Tanzania, for example, uses mid-level workers and has used them for a long period of time. So we can learn from that. However, I think South Africa, on the basis of the experiences that we'll get, there's a lot also that we can probably that the rest of the continent will learn over time in terms of what we're doing here. Because there are many aspects of the burden of disease that we're facing that actually mirrors far much more what's happening in the rest of the continent. And to the extent that we succeed in addressing especially some of these challenges, I think it would be important learnings from that.
Well, just to finish off, you clearly think it can work. When do you think we're going to start seeing some results, where we start getting some clarity from these pilot schemes?
I mean, it's difficult to say, but my sense would be that probably year 3 from now, we probably would begin to have some fairly tangible results on the basis of which we can probably be in a better space to generalize, to generate far much more details on what will be done next.